1. Which chamber of the heart has the thickest wall? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. Answer. Option D. The left ventricle has the thickest muscular wall because it pumps oxygen-rich blood to the entire body through the aorta. It needs to generate the highest pressure among all heart chambers. 2. Which valve is located between the left atrium and left ventricle? A. Tricuspid valve. B. Pulmonary valve. C. Mitral. Bicuspid valve. D. Aortic valve. Answer option C. The mitral valve allows blood to flow from the left atrium to the left ventricle and prevents blood from flowing backward into the atrium during ventricular contraction. 3. Which valve is located between the right atrium and right ventricle? A. Tricuspid valve. B. Pulmonary valve. C. Aortic valve. D. Mitral valve. Answer option A. The tricuspid valve ensures one-way blood flow from the right atrium to the right ventricle and prevents backflow during systole. 4. Which structure is known as the natural pacemaker of the heart? A. AV node. B. Bundle of his C. Purkinje fibers. D. SA node. Answer option D. The sinoatrial SA node generates electrical impulses that initiate each heartbeat and control the normal heart rhythm. 5. Which blood vessel carries oxygenated blood from the lungs to the heart? A. Pulmonary veins. B. Superior vena cava. C. Inferior vena cava. D. Pulmonary artery. Answer option. Pulmonary veins are the only veins in the body that carry oxygen-rich blood. They transport oxygenated blood from the lungs to the left atrium. 6. Which arteries supply blood to the heart muscle? A. Pulmonary arteries. B. Carotid arteries. C. Coronary arteries. D. Renal arteries. Answer option C. Coronary arteries branch from the aorta and provide oxygen and nutrients to the heart muscle, myocardium. 7. What is the largest artery in the human body? A. Pulmonary artery. B. Coronary artery. C. Femoral artery. D. Aorta. Answer option D. The aorta is the main artery that carries oxygenated blood from the left ventricle to all parts of the body. 8. What is the normal resting heart rate in adults? A. 40 to 60 beats per minute. B. 50 to 80 beats per minute. C. 60 to 100 beats per minute. D. 100 to 120 beats per minute. Answer option C. A normal adult heart rate ranges from 60 to 100 beats per minute. Rates outside this range may indicate bradycardia or tachycardia. 9. Which side of the heart pumps deoxygenated blood to the lungs? A. Right side. B. Both sides. C. Left side. D. Left atrium only. Answer option A. The right atrium receives deoxygenated blood, and the right ventricle pumps it to the lungs through the pulmonary artery. 10. Which chamber receives oxygenated blood from the lungs? A. Right atrium. B. Right ventricle. C. Left ventricle. D. Left atrium. Answer option D. Oxygen-rich blood returns from the lungs through the pulmonary veins and enters the left atrium. 11. The heart is located in which cavity? A. Abdominal cavity. B. Mediastinum. C. Pelvic cavity. D. Cranial cavity. Answer option B. The heart lies in the mediastinum, the central compartment of the thoracic cavity between the lungs. 12. What is the outer protective covering of the heart? A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. Answer. Option D. The pericardium is a double-layered sac that surrounds and protects the heart while reducing friction during heartbeats. 13. Which layer forms the muscular wall of the heart? A. Endocardium. B. Epicardium. C. Pericardium. D. Myocardium. Answer option D. The myocardium is the thick muscular layer responsible for the contraction of the heart. 14. Why does the AV node delay the electrical impulse? A. To increase heart rate. B. To allow ventricles to fill with blood. C. To reduce blood pressure. D. To open the valves. Answer option B. The AV node briefly delays the impulse, so the atria can finish emptying blood into the ventricles before ventricular contraction begins. 15. Which vessel carries deoxygenated blood from the heart to the lungs? A. Aorta. B. Coronary artery. C. Pulmonary artery. D. Pulmonary vein. Answer option C. The pulmonary artery is the only artery that carries deoxygenated blood. It transports blood from the right ventricle to the lungs. 16. How many chambers are present in the human heart? A. 2. B. 3. C. 5. D. 4. Answer option D. The heart consists of 2 atria and 2 ventricles, allowing efficient separation of oxygenated and deoxygenated blood. 17. What happens during ventricular systole? A. Ventricles relax. B. Ventricles fill with blood. C. Ventricles contract and pump blood. D. Atria receive blood. Answer option C. During systole, the ventricles contract and pump blood into the pulmonary artery and aorta. 18. What happens during a ventricular diastole? A. Ventricles contract. B. Blood leaves the heart. C. Ventricles relax and fill with blood. D. Semilunar valves open. Answer option C. During diastole, the ventricles relax, allowing blood to flow into them from the atria. 19. Which valve prevents blood from flowing back into the left ventricle? A. Aortic valve. B. Tricuspid valve. C. Pulmonary valve. D. Mitral valve. Answer option A. The aortic valve closes after blood enters the aorta, preventing backflow into the left ventricle. 20. Which chamber pumps blood into the pulmonary artery? A. Left atrium. B. Left ventricle. C. Right atrium. D. Right ventricle. Answer option D. The right ventricle pumps deoxygenated blood to the lungs through the pulmonary artery. 21. Which chamber pumps oxygenated blood into the aorta? A. Left ventricle. B. Right atrium. C. Right ventricle. D. Left atrium. Answer option. The left ventricle generates the highest pressure to pump oxygenated blood throughout the body. 22. Which electrolyte is most important for normal cardiac conduction? A. Calcium. B. Sodium. C. Magnesium. D. Potassium. Answer option D. Potassium plays a vital role in maintaining the heart's electrical activity. Abnormal potassium levels can lead to dangerous cardiac arrhythmias. 23. The first heart sound, S1 or lub, is produced by the closure of which valves? A. Aortic and pulmonary valves. B. Mitral and tricuspid valves. C. Pulmonary valve only. D. Aortic valve only. Answer option B. The closure of the atrioventricular, AV, valves marks the beginning of ventricular systole and produces the lub sound. 24. The second heart sound, S2 or dub, is produced by the closure of which valves? A. Mitral and tricuspid valves. B. Aortic and pulmonary valves. C. Tricuspid valve only. D. Mitral valve only. Answer option B. The closure of the semilunar valves marks the end of ventricular systole and produces the dub sound. 25. Which vein carries deoxygenated blood from the upper body to the heart? A. Pulmonary vein. B. Inferior vena cava. C. Superior vena cava. D. Coronary sinus. Answer option C. The superior vena cava returns deoxygenated blood from the head, neck, upper limbs, and chest to the right atrium. 26. Which side of the heart contains oxygenated blood? A. Right side. B. Left side. C. Both sides. D. Neither side. Answer option B. The left atrium and left ventricle contain oxygen-rich blood that has returned from the lungs. 27. Cardiac output is calculated by A. Heart rate divided by stroke volume. B. Stroke volume divided by heart rate. C. Blood pressure times heart rate. D. Heart rate times stroke volume. Answer option D. Cardiac output is the volume of blood pumped by the heart each minute. It equals heart rate multiplied by stroke volume. 28. What is the normal ejection fraction, EF, of a healthy adult? A. 20 to 30%. B. 30 to 40%. C. 40 to 50%. D. 55 to 70%. Answer option D. Ejection fraction measures how much blood the left ventricle pumps with each contraction. A normal EF is 55 to 70%. 29. Which structure carries electrical impulses from the AV node to the ventricles? A. SA node. B. Coronary artery. C. Bundle of his D. Pulmonary vein. Answer option C. The bundle of his conducts. Electrical impulses from the AV node to the bundle branches and Purkinje fibers, causing ventricular contraction. 30. Which statement about the pulmonary artery is correct? A. It carries oxygenated blood to the body. B. It enters the left atrium. C. It carries deoxygenated blood from the right ventricle to the lungs. D. It is the largest artery in the body. Answer option C. The pulmonary artery is unique because it carries deoxygenated blood from the right ventricle to the lungs for oxygenation. Subscribe for more videos.